welcome to The Explainer. Today we're diving into a really high-stakes medical puzzle. What happens when the very thing meant to keep a patient safe during surgery is also the thing that could cause the most harm? It's a dangerous paradox, and we're going to look at the incredibly clever way a team of doctors managed to solve it.
Really think about that question. This wasn't some thought experiment. This was the terrifying reality facing a team of anesthesiologists with a young patient in a really tough spot.
Okay, so let's get into our first section, a dangerous medical paradox. To really understand the corner these doctors were backed into, you first have to understand the rare condition at the heart of this story.
It's called juvenile dermatomyositis, or JDM for short. Basically, it's an autoimmune disease where a kid's own immune system gets confused and starts attacking the blood vessels in their muscles and skin. The result? Serious muscle weakness. We're talking kids who have trouble just getting up from a chair or even swallowing their food.
And this is the paradox. In pretty much any standard surgery, doctors need muscle relaxants. They keep the body completely still so surgeons can do their work. But for a JDM patient, those exact same drugs are like a landmine. They can trigger all sorts of awful reactions. Prolonged weakness that means you need a ventilator to breathe, or even something called hyperkalemia, which is a massive spike in blood potassium that can literally stop your heart.
And trust me, this is not just some theoretical what if. This quote comes from a study where a common muscle relaxant caused an abnormal contracture. In plain English, that means the kid's muscles on the operating table could suddenly seize up, uncontrollably. For an anesthesiologist, that is an absolute nightmare scenario.
So now, let's see how this abstract medical problem becomes a very real, very urgent crisis for one specific patient.
Our story really kicks off with a 14-year-old girl. She shows up at the hospital with that classic, severe abdominal pain. Sure enough, it's acute appendicitis. Normally, that's a routine emergency surgery. But as her doctors were about to find out, there was absolutely nothing routine about her case. You see, her timing was just incredibly tough. For the last couple of months, she'd been showing all the signs of JDM. And literally right before this appendicitis attack, she got the official diagnosis. Can you imagine that? You're just trying to wrap your head around this new, serious chronic illness, and bam, you're being rushed into an emergency room for something totally different. So this put her medical team in a really tough spot. They had to operate, but their standard playbook was filled with danger. How in the world were they supposed to get the surgical conditions they needed without using the drugs that could cause a total catastrophe?
And this brings us to Section 3, a two-part clever solution. Because with the old rule book thrown out the window, her doctors had to get creative. They had to invent a whole new plan just for her.
And their solution was honestly brilliant. It was this elegant 1-2 punch designed to dodge all the main dangers. Step 1, figure out a way to secure her airway without using those system-wide paralyzing drugs. And step 2, find a way to relax only the specific abdominal muscles the surgeons needed, leaving the rest of her body completely alone. So part 1 of the plan was this device, the ProSeal LMA. Now, a traditional breathing tube goes all the way down the windpipe, and for that, you have to paralyze the patient. But this thing is different. It just sits right on top of the larynx and creates a seal. It keeps the airway perfectly safe and secure, but, and this is the crucial part, it doesn't require any of those dangerous muscle relaxants. It even has this extra port to drain the stomach, which is another great safety feature.
Part 2 was something called a tap block. The easiest way to think about this is like a super precise, targeted numbing shot. Using an ultrasound to see exactly where they were going, the doctors injected local anesthetic right into the abdominal wall. And this did two amazing things. It provided fantastic pain relief, and it relaxed the stomach muscles, exactly where the surgeons were working, without affecting a single other muscle in her body.
All right, so the plan sounds amazing on paper. But the real question is, right? Did it actually work in the operating room? Let's take a look.
Let's start with the most important number of the whole story, 0. That is how many doses of the high-risk muscle relaxants they had to use. They did the entire 40-minute surgery, got the perfect conditions they needed, and completely avoided the biggest danger. That is a massive, massive win.
And here's the next key number, 12.
For 12 straight hours after the surgery, the patient was completely pain-free, all thanks to that tap block. And that's not just about comfort, it also meant she needed far fewer powerful opioid painkillers, which is another huge benefit. And really, the success was just total. No complications at all. The surgeon said they had good surgical access, which means the muscle relaxation from the tap block was perfect. Her airway pressures were stable and low the whole time. She was fully awake when they took the airway device out, and she went home the very next day. It was a textbook success story, just achieved with a totally out-of-the-box approach.
So, this is way bigger than just one successful surgery. This single case has implications that reach far beyond this one patient.
The big takeaway here is actually pretty simple, but it's incredibly powerful. We now have proof that this combination, the special airway, plus the targeted nerve block, is a safe and really effective way to do surgery on kids with JDM. It gives doctors a new, safer path forward. And you don't have to just take my word for it. This is what the doctors themselves wrote. This case isn't just a cool story. It's another piece of solid evidence. It helps build the argument for changing the standard of care and making this new, safer approach more common for these vulnerable kids.
In the end, this whole story just goes to show how creative thinking, born from the needs of a single patient, can completely rewrite the rules. And it leaves you wondering, right? What other standard procedures in medicine are just waiting for a fresh look? What other paradoxes are out there, just waiting for their own clever solution? Thanks for joining me on The Explainer.